Matthew Holt, THCB Quick Bite. This is Kris Engskov. He is the CEO of a company called Rippl. Look, there's Rippl. And Rippl is in the business of care for people with dementia.
That's right. We have a wraparound care model. We take care of patients and caregivers that have dementia, and we keep them at home and out of the ED and the hospital.
That sounds like a very clever idea. A lot of people with dementia, not a lot of good solutions so far. So how does it actually work?
Well, that's right. There aren't a lot of good solutions because we never really paid for it, and that's what we're trying to fill a big gap around. The way it works today is we have a collaborative care model, which has been successful in lots of other parts of healthcare, as you know. We take a care navigator, a licensed social worker, and a nurse practitioner, and we put them in a collaborative care model, and we wrap around a patient and their caregiver. Two big secret sauce things there. One is that caregiver is foundational to us being successful in ultimately doing what we say we do, which is keep them out of the hospital. They are as much a patient as the patient themselves, and we take care of that caregiver very, in a very curated way. The other thing is we coordinate...
Stop and tell me more about that. Do they get paid? Do they get support? Some of the support that they get? What happens to the caregiver?
We bring them in from the earliest day. We don't... we have to have a caregiver involved for it to be successful in this care model. And we can give them as much care as they need. We particularly do a lot of therapy with those caregivers, because we know that by lowering stress and giving them more confidence and giving them access to resources, we got a far better chance of them being successful taking care of that patient at home. The other thing we do is we coordinate closely with a primary care doc, which we're not trying to disintermediate a doctor here. In fact, if anything, we're trying to work with a doctor closely to extend their care, to give them resources maybe they don't even have, to help keep this patient at home.
So what actually is moving the needle on what here, right? So you mentioned the caregiver and extending their ability to do more at home. We've seen some people have tried that a little bit. There's been people trying to sort of care. There are people like Alex Drain promoting the fact that there are caregivers and, waving the flag. She was on stage at Health yesterday talking about that. But what actually moves the needle on something that a payer will care about for this population? And I assume the payer you're talking most about is Medicare Advantage, but maybe other maybe Medicare Fee for Service. What's going on in the background that when you go to somebody and say, if you do this, it'll move the needle on outcomes, dollars and cents? What is it?
Well, I'm going to try to address your first. Yeah, two questions here. Why would a payer care, and then what's most important? What's working? So a payer should care because these folks are very expensive.
Sure.
I say all the time, we don't like people in America with dementia, or we'd have far better care for them. And we've really never paid for that care. And what we're trying to do this with a value-based model, to share risk with payers, because there's a lot of financial outcome at stake here, frankly, because of what I said earlier, which is because these folks end up in the ED in the hospital and then post-acute far too often. Now, what's working is two things, and I'll say it again, I already said it, but you pull that caregiver in really early, you identify the patient as early as possible and get them wrapped around with that care so that they can navigate the disease with people who are experts, which is us. And you work closely, I think second thing, work closely with that primary care doc to make sure that you are tightly coordinated.
All right, well, go a bit deeper on that. What are the interventions and who has got what piece of technology, and what's the flow behind the scenes that's making that happen?
Well, so we can diagnose, but oftentimes we take people who are already diagnosed. We are bringing them in as close to that time as possible so we can capture that engagement moment. And we are sitting down with them with a expert care navigator who meets them and their caregiver and talks through the journey. What can we do, and what kinds of services can we offer you? And
do you have does the consumer have a technology front end that they're using? Does your caregiver have what has Rippl built to help that partnership?
Well, we're pretty early in terms of how we're using technology, but we are going to have what I would call an AI-enabled platform in Q4 here, where we're going to start to use that. Today, we're doing mostly one-to-one engagement, either face-to-face. And I would just say that that's really important with this population.
Sure.
Once you can get them engaged and get them onto service with our teams, it's great. We can do a lot of async and other technology solves to save time for the caregiver and the patient. But up front, it has got to be one-to-one, face-to-face, because you've got to build trust with that patient or this won't work.
All right. So let's tell a little bit about Rippl, the company. You raised, I think, $50-odd million over a couple of rounds.
We raised $52 million so far from a spectacular group of investors.
General Catalyst, Holly Maloney's involved, and a few others, right?
General Catalyst is a great investor. As Holly Maloney's on our board, thankfully, and Arch, F Prime.
You're trying to remember all these guys, because the ones who you don't mention will get upset and say, "Hey, Kris, you wanted it?" No, I'm kidding.
F Prime, GV, and Mass General Brigham Ventures.
All right, that's great. And then, how old is the company? I know you came from Starbucks, which is a bit of an interesting lateral, but how old is the company? What's the progression so far into like getting stuff built and getting patients on the platform?
Yeah, our company was kind of, I'm going to say, kicked off in September of 22. We closed our seed round. Yep. We've been serving patients since January of 2023.
Yep.
And, we're now in 4 states, going to a 5th here in the next couple of months.
All right, so kind of early days, but a massive problem. All right, Mr. Kris Engskov, he is the CEO of Rippl. Kris, thanks for your time.
Thank you, Matthew.